My name is Joyce Harper and I'm the Programme Director of two MSc programmes in the Institute for Women's Health, University College London. One MSc is on Prenatal Genetics and Fetal Medicine, which has been running since 1996, and the second is on Reproductive Science and Women's Health, which has been running since 2009. You can find out more information about both programmes at the Institute for Women's Health's webpage. This video is introducing the module on Preimplantation genetic diagnosis and developing technologies, which I co-run with Dr Joyce Harper. I've been working in the field of IVF for over 25 years and in PGD for 20 years. I was the co-founder of the ESHRA PGD Consortium, of which I am currently past chair, and I'm chair of the ESHRA Special Interest Group in Reproductive Genetics. I've written 2 textbooks on preimplantation genetic diagnosis. Joyce Harper heads our diagnostic team and has been at UCL for almost 20 years. She is the head of the External Quality Assessment Scheme for PGD. Please see our website for UCL Centre for PGD. The aim of the module is to provide knowledge into the theory of preimplantation genetic diagnosis and developing technology, including stem cells. The learning outcomes are to demonstrate knowledge of PGD, including the diagnosis of sex, chromosome abnormalities, aneuploidy screening, monogenic disorders, and future technology, including stem cells, and to understand the ethical issues surrounding PGD and developing technology and why they are important in modern society. As well as lectures, the module involves discussion groups, tutorials, DVDs, a practical of FISH and array CGH, and ethical discussions. Uniquely on our MSc programmes, we have observation days and a number of clinics relating to this module. All students attend at least one observation day in an IVF clinic, which includes the London Fertility Centre and the Centre for Reproductive and Genetic Health, and also an observation day in the Fetal Medicine Unit. PGD was developed to help patients at risk of transmitting a specific genetic or chromosomal abnormality to their children so that they could have an unaffected child. The main option for such couples are prenatal diagnosis, but if couples wish to start the pregnancy knowing the embryo is unaffected, they can opt for PGD. We will also discuss preimplantation genetic screening, which is a method used to aid embryo selection for infertile patients going through IVF. This involves looking at the chromosomes of embryos, but at the current time there are no studies which have shown that this technique improves IVF delivery rates. For PGD and PGS, patients have to first go through IVF procedures to develop embryos in the lab, in vitro. A few cells are biopsied from the embryo and these are used for the genetic analysis. A detailed talk about PGD and PGS can be found on YouTube. Please visit UCL Centre for PGD website for this link. In this module, we will discuss all aspects of PGD and PGS and also explore developing technology such as stem cells. We will have several ethical discussions about these technologies, and the module is the last of our both MSc programmes and it brings together many topics from other taught modules. In all our MSc modules, we have both formative and summative assessment to develop key skills that you will need in your future careers. For this module, both types of assessment are linked. Task 1 involves each student choosing 2 scientific papers on a topic of new technology and undertaking a critical review of these papers. This is presented as an oral presentation and also written up as a 1,500-word summative assessment. The aim of this task is to prepare you to critically evaluate scientific papers and to learn how to write a paper review, as well as gain experience in oral presentations. Task 2 involves a group and individual activity. Groups of students are given a real-life PGD case to study and prepare an in-depth analysis of all the issues relating to the patient history, writing a proposal for an application for funding, and orally presenting the case to your peers. The aim of this task is for you to employ decision-making skills about how to do the diagnosis, to assess the viability of the procedure and how to cost it, and to prepare a proposal for funding. As it is a group activity, it will give you experience with working as a team. For the summative assessment, this case report will be written up individually by each student in a 1,500-word report. Each year, some of our students go on to careers in embryology and PGD. You can visit the Institute for Women's Health Employability page to find out testimonials from past students and information on careers in these areas. We also run careers afternoons dedicated to clinical embryology and genetic careers. For further information, please visit the Institute for Women's Health webpage.